Access group, and it was published today. So you've got something hot off the press. But here you've got the person live here with us. Dennis, it's all yours.
Okay, what I'm going to do is can you pass this around? I don't want to.
Oh, sure.
As it is, it came out today. Now, how many people are associated with health in one form or another? It's okay, you can admit it. And so this is going to be coming from a health perspective. But as you're going to see, it's not a perspective that's been generally well accepted, received, or even acknowledged in the health community. And what I mean by the health community is certainly the healthcare community, but also the population health community, the health promotion community, and anybody else who expresses the belief or the statement that they're concerned about the health of the population. And you'll see over the years, back in 1994, over in the McMurrick building, when I first moved into health from human development, I remember somebody said to me, why don't you review Richard Wilkinson's new book on inequality and health? And I read this. This was called Unequal Societies, the Afflictions of Inequality. And this was about 1996. And as I was reading it, and as Wilkinson was describing what had happened during the Margaret Thatcher years, it was like home movies. It was exactly what was happening in terms of the Mike Harris era and the Paul Martin era. And I was of the belief, and it turns out that I do remember the first time I had a speaking invitation in Nova Scotia to talk about this. I was of the view, having been brought up like you perhaps have been brought up, believing in rational government, democracy, pluralism, and policymaking, that all I'd have to do is go out and tell people that when you produce a lot of poverty, a lot of inequality, when you cut back on individual security, you have a lot of adverse outcomes. Well, nothing happened. And as the years went by, I kept peeling the onion open, trying to figure out what was going on. Why was it when Canada was recognized in theory as a leader in health promotion, we were doing such an awful job in actually doing it? So this is kind of the end of a journey, but I'll also be leading up to it. And the basic conclusion I come to, I was trained as a developmental psychologist, but the conclusion I've come to is that it's about the political and economic organization of a society. It's not about research, another article in Social Science and Medicine. It's not as if this is about going to Dalton McGuinty and saying, you know, if you do A, B, C, and D, life's going to get better for people, and we're going to have higher quality of life, and don't you want to do that? It's not about that at all, and I'll try to suggest to you what it is at all. And in the end, I'll also suggest that there is a way forward. Now, ultimately, in this area of what determines health, there's a variety of discourses or arguments or ways of seeing the world. And ultimately, it comes down to which view, which understanding of the world not only best explains how we got to this point, but best explains how we can get out of it. And I spoke to International Epidemiology conference 2 weeks ago, and I said to them, in order to take any of the determinants of health stuff seriously, you have to have a theory of society. And I don't get the sense that that's what they teach you in epidemiology, is it? And they all laughed. So it comes down to, if you think that the world's going to be a better place and everybody's going to be healthy, if everybody stops smoking, you're going to spend the next 40 years of your life trying to get people to stop smoking. If, on the other hand, you believe that society is becoming increasingly unequally unbalanced, with particular sectors having a more important role in influencing public policy, then you're going to take a very different approach. And I've come to the opinion that the approach that I'm suggesting today will be the most effective in the long run in terms of promoting health, improving quality of life, and so on. So with that introduction, in health promotion, Canada has this reputation of health promotion. whether it was the Lalonde Report in 1974, the Epp Report in 1986, the Ottawa Charter, and I'll give you a list of them in a second. But the Ottawa Charter has really withstood the test of time. And the main concepts that emerge from the Ottawa Charter, and it's called the Ottawa Charter because the first International Conference of Health Promotion took place in Ottawa. But it was very much influenced, the content, by what was going on in Canada. The first thing is, and this is not original, I was in my last year of high school when I read Abraham Maslow, Towards the Psychology of Being, where the prerequisites of health, without peace, shelter, education, food, income, a stable ecosystem, sustainable resources, social justice, and equity, you can't really have health. And I remember in 1992, when I first came across this, it was kind of sounded third worldish, Africa, South America. But as the years come by and the food banks began to appear and the homelessness crisis, it became increasingly germane to the situation in Canada. So the first concept is you've got to provide people with the prerequisites of health. If you don't give them that basic level, you can't expect health. The second aspect of health promotion, which you don't hear a lot of nowadays, is the idea of citizen empowerment. That basically people should have a right to influence public policy. They should be able to control the determinants of health. And the way it's stated here is people cannot achieve their fullest health unless they're able to take control of the things which determine their health, of which a really important part is public policy. And the third aspect of the Ottawa Charter, and this is something that's not limited to health studies, but also psychology, sociology, and just about anybody, is we act as if governments don't exist. That there's no such thing as government that passes laws and policies. There's no such thing as government that sets minimum employment standards. So instead we talk about lack of education or low-income people, somehow implying that low-income people that brought the issues on themselves, rather than looking at the government policies that either provide people or do not provide people with benefits, with job security, with the right of collective bargaining. So in the health promotion paper that's circulating around, I basically make the argument, let's look at these key health promotion concepts and let's try to operationalize them in a broad sense to see to what extent we can explain the gap between Canadian public policy and Canadian public policy and Canadian rhetoric about the social determinants of health or prerequisites of health. So this is just the shopping list. And I won't tell you how many times I get emails from people. Most recently, we're a government delegation from Ireland, and we're coming to Canada. We'd like to come meet you. And of course, I live downtown, and York is all the way up there. So I always have people come by the house. So these 4 Irish people come in, they sit down, and I said, let me guess why you're here. You're here because you want to find out how Canada became such a health promotion powerhouse. She said, yeah, how do you know that? I said, well, it isn't. And then as we continue the conversation, I'll say everybody here thinks that Ireland is an anti-poverty powerhouse. And she said, oh, no, we're not. And I said, the issue is that you people sit in Dublin and you go to the Health Canada website and you see all these wonderful things there and you think we're really doing the stuff. So the Lalonde Report was 1976. He talked about the environment in addition to health care. The Epp Report in 1986, Lalonde was 74, Epp was 86, talked about equity and the prerequisites of health. The Ottawa Charter I've mentioned. The Healthy Cities movement began in the city of Toronto. And it doesn't exist anymore in the city of Toronto, but it's really been picked up in Europe and has had tremendous impact. And basically, the approach of the Healthy Cities movement, and I would be remiss not to point out that it really had its heyday when Jack Layton was chair of the Board of Health, is that people's environment shape health, and people living in cities should have control and should be able to influence these. The CIAR, Canadian Institute for Advanced Population Health, were a bunch of epidemiologists, many of which were at the U of T, that outlined a broader approach to understanding traditional epidemiological health issues. The population health template just happens to be something that Health Canada prepared that talks about looking at upstream influences. The Senate, and I've become a real supporter of the Canadian Senate recently, the Senate put out a wonderful report that pointed out how Health Canada has become a laggard, or I should say Canada is a laggard in applying any of these principles that they've developed. The health officer of Canada puts out these tremendous reports, but he always puts them out Friday afternoon with no press conference, no press release. So he put out one 2 weeks ago, and I just happened to find it by accident. And of course, the media won't cover any of this, so we're on our own. And then finally, there was this big major WHO Social Determinants of Health Commission, of which your tax dollars funded an awful lot of it through grants from Health Canada. And Monique Bejan and Stephen Lewis were two commissioners on it. And an awful lot of the work took place within Canada and was focused here by Clyde Hertzman at UBC, by Ron Labonte at Ottawa, and Carlos Montagne, who's at nursing at U of T, was very much involved in another aspect of what they call the knowledge hubs. However, in this regard, Canada's recent performance suggests a bleak prognosis. In this article, we looked at Canada's track record in 5 areas: the overall redistributive impact of tax and transfer policies, and I'll simply state taxes went down on the rich and they went up on the poor, to summarize it. Reduction of family and child poverty. The OECD identified Canada as one of the 2 countries, with Germany showing the greatest increases in family poverty. Housing policy, well, we know about housing policy. Early childhood education and care. Well, everybody may think Fraser Mustard's a saint, if you know who Fraser Mustard is, but we don't do anything that he suggested. And I'll show you some evidence about that. And of course, living in Toronto, we certainly know how the city's been going downhill for the last 10 to 15 years. And very simply because we don't want to spend, the powers that be don't want to spend money on anything.
In the last 20 years, the maternal mortality ratio has also doubled in this country.
In 1980, Canada was ranked 10th of 30 countries in infant mortality rates. Now, while our infant mortality rates have actually improved, we're now ranked 24th of 30 countries. So 10th in 1980, 24th in 2007. And it's not just Aboriginal, it's everywhere. The city of Toronto, the poorest neighbors, have a rate of 5.8, which you'll see is well above national averages of many countries. So, in the UK, they have this down a lot better than we do. And in a report that came out in Health Promotion International, and Claire Bamber and Debbie Fox and Alex Scott Samuel have a group called the Politics of Health Group in the UK, they point out it's profoundly paradoxical that in a period when the importance of public policy as a determinant of health is routinely acknowledged, there remains a continuing absence of mainstream debate about the ways in which the politics, power, and ideology which underpin it influences people's health. And this is one of the reasons that public health across Canada has been struggling with the social determinants of health or the prerequisites of health. Because ultimately it's political. What do the political scientists say? Politics is the study of who gets what and why and how. So one of the things, and you know, I was at Public Health Sciences for 10 years, and it was only when I was editing this book in 2004 that Diane Gabrielle Tremblay, who was writing a chapter about employment insecurity, mentioned that there was this typology of different forms of the welfare state. And Martha Friendly, who was writing about different approaches to childcare, also brought up Espy and Anderson. And everybody seemed to know about Espy and Anderson, but I had never run across Espy and Anderson in any of the population health or health promotion literature. And when I picked up his 1990 book, which is called The Three Worlds of Welfare Capitalism, it was like a veil had lifted. And basically what he did back in 1990, he said, and this was, it wasn't based on his dissertation, but it grew out of it. He said that when you look at wealthy developed country, there seems to be three kinds of countries. And I'll show you a graphic which really summarizes it. And he said, first of all, there look to be these liberal welfare states. And it turns out they're English speaking, and they all, they're the UK, Canada, Ireland, United States. Some of them include Australia and New Zealand. And basically, these are the liberal welfare states where we don't do a lot for people. Benefits are very modest and often attract strict entitlement criteria. For example, if you lose your job, you have $2,000 in the bank, and you walk into social assistance office, the first thing you got to make sure you do not do is wear grandma's engagement ring, because they'll make you sell it. And in fact, when you walk in and say, I got 3 kids, the rent's $1,000, the social assistance person will say, do you have any RRSPs? Do you have $2,000 in the bank? Do you have an RESP? Get rid of all of that and then come back. You have to be absolutely destitute to get social assistance in Ontario and in most other places. And then he said, and I'm going to jump down to the social democratic, and he said there was a bunch of countries, Norway, Sweden, Denmark, and Finland, and these countries provide benefits that are universal. They're comparatively generous. Unbelievably as it may seem, there's a commitment to full employment and income protection, and a strongly interventionist state used to promote equality. And I'll show you again a slide in a minute or two that expands upon that. Now, it used to be that in Canada, we used to say, why can't we be like Norway? Why can't we be like Sweden? Well, I'll suggest things have gotten so bad that it would be really good if we were a conservative welfare state. France, Germany, Netherlands, Belgium. Because these countries they're certainly not socialist. They tend to be ruled by Christian democratic parties. But back in 1848, when all the revolutions broke out, some very wise people figured that if we don't get our act together and provide people with some sense of security, we're going to be next. So the Bismarckian welfare state, which was developed initially in the late 1860s, 1870s, are rather common in continental Europe. And I'll again lay it out for you again, but the best way to think about it, especially for our old folks, is think red Tories. Think red Tories, think Bill Davis, think, John Tory. We're not socialists, and I'm certainly not going to move out of Rosedale. But gee, we got to provide people with what they need to live and eat. And probably, as they discovered in continental Europe, if we treat our workers well, we increase productivity. But I'll get back to that in a second. So one of the things I say to my students, and I'll say to the youngsters here, think of your future. Think of whether you're going to be happy and healthy, whether you're going to have money, whether you're going to have a nice house or not. Which is going to be the institution or the agency or the way that you're going to accomplish this? Can we count on the government to do that for us? That government will pass laws that will provide us with decent wages, security, keep us away keep the wolf away if bad things happen to us? Or do we have to depend on our family? Now, up at York University, the kids all shake their heads, no. Family's not possible. U of T is usually a bit different. You ask people at York, how many of your parents are rich? None of them raise their hand. U of T, a lot more raise their hand. Or is it going to be how you sell yourself on the marketplace, your job you get? And overwhelmingly, my students say it's going to be the job I get, how I sell myself on the marketplace. And what I'm going to suggest to you is this commitment to either the marketplace or the state not only represents one of the real differences between Canada and other liberal countries versus the conservative or the social democratic countries, but it also points the way forward about how we might be able to improve the situation here. And the idea being that we have to get Canadians to have the same belief in the state for issues such as childcare, public transportation, housing, that they currently have for Medicare. And that's not going to be easy to do. Now, Paul Bernard, and I forget St. Arnaud's name. Paul Bernard is a sociologist at the U of T. I've never met him, but I use this slide more than anything. And to me, this slide, when I first came across it, it suddenly made sense. Everything began to make sense. What does it basically say? Well, it says that if we look at the Espin Anderson, and you see these people add a fourth one, if we look at the social democratic countries, let's ask, what's the main ideological inspiration that we could abstract out of their public policy out of the last 40 years? And unbelievable as it may sound for us living in Ontario or Canada, the primary ideological inspiration is one of equality, where all of their public policy has historically been concerned with reducing poverty, inequality, and unemployment. They also do very well on gender issues. And how do they do it? Well, they basically do it through the organizing principle of universalism. Their literature, their public policy documents are shot through with concepts of human rights, of universalism, of providing people with what they need for a good life. The way that they do it is provision of resources to people, and I'll give you some evidence about that. And the primary institution that's responsible for this is the state, the government. The government passes laws about benefits, about employment, about training. Now, contrast that with the liberal political economy. So on the way to the, I think of it this way, that if you happen to be in Sweden or Norway and you're driving to the Riksdag, as you're driving, what are you thinking about doing once you get to Parliament? You're thinking about reducing poverty, reducing inequality. Now, let's move to Ontario. You wake up in the morning, you're driving on the way to Queen's Park or to City Hall. What are you trying to think? What do you think? What can I do today? How can I minimize government intervention? How can I get the government out of housing, out of Ontario Hydro, out of daycare, out of health care? Why do they believe that? Because they honestly believe, or do they, but I'd like to think they honestly believe, is that the marketplace not only is, but should be the central institution. The invisible hand of Adam Smith will make life better for us. Now, why would they believe that? Well, why wouldn't they believe it? Because the powers that be have really big houses. Usually they're men, so they have beautiful wives. They have riches, and they've earned it through the system, right? If you're a CEO of Rogers, or you're the CEO of Bell Canada, capitalism has been good to you. Why wouldn't you believe this? So in a liberal political economy, unless we intervene, the dominant approach is going to be one of emphasizing liberty, minimizing government intervention, weakening programs because we tell people that if we're too generous, then people won't work as hard. And of course, the joke among people like me is that in order to make the rich work harder, you have to pay them more. But in order to make the poor work harder, you have to pay them less. You can think about that. So they say that, oh, well, we still provide residual support. We take care of the, I can't see that. We take care of the essential needs of the most deprived. And even then, we don't do that. We do a terrible job of taking care of the needs of the deprived. Now, as things have gotten worse and worse, I now longingly look at the conservative welfare states. And the conservative welfare states are not socialists, but they believe in solidarity. They basically believe, and this has developed over time, very much influenced by the Christian church, a paternalism of the masters watching over the flock. And their primary concern is promoting solidarity. And the solidarity that's up there is social, yeah, please read it. This thing is really, social security, wage security, and social integration. Thank you. And what they do, here's another way to think about it, is surveys are frequently done that ask poor people and rich business people in the United States and Europe, should government have a role in reducing poverty? And what you find is that business people in Europe are more supportive of that than poor people are in the United States. So what's evolved in Europe, in the conservative countries, is this noble oblige that, you know, we're all Germans, we're all Swiss, we're all Belgians. Now, I think that creates issues when we come to immigration. And that's why I think the conservative countries have problems with immigration issues. But if you've ever been to Switzerland, as we were 2 summers ago, they invest in public transportation, there's housing. It's not bad. You don't have to be a socialist anymore to complain about things in Canada. And finally, what St. Bernard and Bernard identify, what they call the Latin political economies. Spain, Portugal, Greece, and Italy. And these are seen as undeveloped forms of the welfare state. Vincent Navarro takes 3 of the 4 and says they're post-fascist states. But these are countries that are said to be less developed in terms of their welfare state. And as it turns out, they seem to be the ones having all these debt problems. Portugal, Spain, Greece, and Italy. So in that paper that I'm passing around, and if people can't access Health Promotion International through the U of T, and I know you can, I can email them to you. What I was coming to the conclusion about, I was curious about the countries that talk a lot about it, like Canada. Canada's documents are chock full of explicit health promotion rhetoric, government statements about providing the prerequisites of health, health sector statements about promoting health through public policy and community level activities. And of course, certainly we have no shortage of statements about healthy living or healthy lifestyle. In the paper, and today I'm primarily concerned with the first one, which is about public policy. And it turns out these Scandinavian countries, not only do they seem to do everything right, but they literally believe they're on a mission from God, the way John Belushi did in the Blues Brothers. They translate everything into English. Everything that they do ends up being translated in English. And when you talk to them, not only is their English very good, they really believe that they have something to tell the world. So just as some examples, Finland has this report that defines reducing health differences between population groups as a central goal of public health in Finland. In Norway, in 2007, a national strategy to reduce social differences in health provided a 10-year perspective. Sweden has been doing this for a number of years. The Public Health Objectives Bill calls for decisive measures to improve public health through action on social policy, healthcare policy, labor market, and working on housing, education, and environmental policy. Now, at the U of T, a number of years ago, there was a workshop. There was the Health Equity Conference. And a fellow from England had organized a workshop with the neutral title of, "Can there be equity under capitalism?" So I'm sitting there, and this elderly man, means that they're older than me, gets up and he says, "My name is Gunnar Agren. I am head of public health in Sweden. I am director of the National Institute for Public Health. And I will tell you who's opposed to health equity. He said, first, the capitalists are opposed to health equity. And I said to this guy next to me, this guy's head of public health? And then he said the medical profession was opposed to equity. And then he said, I hate to say this, but the service sector is really opposed to equity. And I think he didn't really mean opposed, but I think he kind of, well, in the first two he did. But in the third, I think he meant kind of not really aware of it. So it turned out I went home, looked him up to make sure he really indeed was the head of health, and he was. And the internet was full of presentations and reports that he's been written. And somebody pointed out that he was from, he wasn't a social democrat. He was from the Swedish Left Party. And the Swedish Left Party is the one who believed the social democrats are too wishy-washy. So it's a different way of thinking out there. Now, I think my real contribution, at least in terms of that conference where I gave this in Geneva and the two papers that are passing around, is if you read the health promotion literature, and there's a book called Health Promotion in Canada, first and second edition, third edition will be coming out in a few months, and in it they have international stories. And the French guy is kind of crying in his soup about how health promotion hasn't caught on in France. And we have to come to Canada to learn about it. And in this particular quotation, the fellow says it's remained hindered by a system still very centered on curative care. So you read that and then you remember, well, the movie Sicko, where Michael Moore goes to France and everybody has child care and everybody, they try to cut pensions and they start burning over police cars and the government. So it didn't really resonate well. The same thing with Germany. These German health promoters are complaining that lifestyle issues of health are emphasized. They then go on to point out that there is a structural approach that looks at improving the workplace, but it's not really part of the Ministry of Health. It's part of the Ministry of Labor. Belgium was another country. A recent report that they prepared for Health Canada basically said that they don't have a global comprehensive policy framework to address the social or prerequisites of health. But he also noted that this lack of a comprehensive health-related social determinants agenda did not dilute the very good healthcare system. So what I wanted to do was not only look at what they say, and the conclusion was that the liberal welfare states like Australia, Canada, and the UK, forget about the US, we just churn out stuff about health promotion and how important the prerequisites of health are. The French and the Germans and the French, Germans, and the Belgians, at least in terms of the English reports, it's not an issue. They don't talk about it. And health promoters feel frustrated and left out of the loop. But there's an awful lot of evidence that they do quite well in terms of providing the prerequisites of health. The Scandinavian countries walk the talk. I won't say more than that. And we didn't really know anything about the Latin countries. But in the article, I point out that the Latin countries are similar to the conservative countries in that all these health promoters are complaining that health promotion is not getting anywhere. We can't get health equity on the agenda. Now, in terms of these liberal countries, the Australian state governments have explicit statements about health equity and addressing health inequalities. Canada, per capita, if you go to Health Promotion International or go to health-related journals, Canadians just dominate the publications. It's really quite something. And in the UK, at least until the recent government, the argument has been by Margaret Whitehead and others that there has been a lot of feverish activity. And I'll provide some evidence that actually the UK is not looking bad until now. So implicit health promotion activity was governmental and institutional activity that manages the extent of income inequality and poverty. They don't talk about it in terms of health, but they seem to manage it. And perhaps implicit health promotion activity also involves government and agencies that promote employment training and reduce unemployment. And we call that active labor policy. And what about kids? What about taking care of the child care needs of citizens, which is both a kid issue and a women's issue? And here I just have some examples. Now, one of the dilemmas that you run across is that everybody agrees that early life is important. But one way or another, instead of raising the issue of supplying every kid with the income that they need to have a decent life, it usually gets channeled into something else. You know what the big one is? Reading to your kids at night. They find literature that find poor people are less likely to read to their kids at night, so they set up big programs to get parents to read to their kids at night. It's not going to hurt, but that's probably the least of these kids' problems. Another big one is the physical activity, the get active. My kid's in grade 6, about every 2 weeks he comes home with hop and jump, Terry Fox run. What's the other one that they do about kids? Secondhand smoke. So what happens is you kind of individualize, breakfast programs. Now I love Olivia Chow, but breakfast programs are bad news. There's a whole literature emerging about how these kids are stigmatized, how they're made fun of. And my view was give the parents an extra $10 a week and let them buy their own cornflakes for them. But no, we'd rather set up Lynn McIntyre calls them feeding programs. And this is an example of how you change the discourse. Breakfast programs makes everybody feel good. A feeding program implies, you're kind of not doing something that attractive. So in early life, if we were really serious about children, we would have policies that assure provision of adequate income to families, either through universal benefits, and that is you have a kid, you get a decent baby bonus, sufficient wages for those that are working, or social assistance levels for people who cannot work. We would also take very seriously the issue of affordable, high-quality child care and early education and benefits. Now, this is not a question of evidence, because the evidence is really clear that all things considered, good, licensed, quality child care is better than not. Now, maybe it's not better than wealthy middle-class moms staying home with their kids, but it's certainly better than leaving your kids down the street with Mrs. Smith or Mrs. Jones, which is what an overwhelming proportion of Canadian women have to do. Now, employment and working conditions. Well, you know what employment health has turned into. Employment health has turned into don't sell French fries in the cafeteria and have some treadmills there. In contrast, what employment and working conditions are really about is about allowing people to have collective bargaining and agreements. Presence of intersectoral bargaining and agreement coordination. And that is that when somebody at Costco gets a collective agreement, that collective agreement is applied to all the other big box stores. The idea of that happening in Canada is like, it's like somebody landing from Jupiter tomorrow. But that's common practice across Europe. Policies that require provision of benefits to part-time and temporary workers. In Europe, most countries require that temporary and part-time workers be provided with benefits that are commensurate to full-time workers. And in the video Pour No More, which you can see, they visit a liquor worker in Canada and then a liquor store worker in Sweden. And it's like two different worlds. Policies that provide training and retraining programs. And I'll give you evidence that Canada's spending on these kinds of programs is like rock bottom, half of what it used to be 10, 15 years ago. And everybody says income and income distribution is important. Well, actually, they don't say it here. Some of us say it. Policies as described above, with additional policies that create more progressive taxation policy that narrows the gap between the top and bottom. Policies that provide greater decommodification. And decommodification basically means that if you can't have a paying job, you're able to get supports and services that you don't have to pay for. And I'll show you something on that. So my hypothesis was that there's two sets of countries that have explicit commitments, at least in terms of their documents, to providing the prerequisites of health. And these are the social democratic countries and the liberal welfare states, including Canada. But in terms of actual public policy, it's extensive in the social democratic countries and undeveloped in the liberal welfare states. There's also two forms of the welfare state where it's just the idea of the prerequisites of health have just not gained traction. But in the conservative welfare states, there is extensive public policy that supports the prerequisites of health. And in the Latin welfare states, there may very well be undeveloped. So here's some data. I love data. This is all from the Organization for Economic Cooperation and Development. So one of the things I say to new faculty members, grad students, and so forth, you never have to really get funding and go out. I mean, funding looks good, and you'll get a merit raise, and it'll probably help you with tenure. But if you want to do research, all you got to do is go to the OECD website, because they churn data out monthly. And what's really needed is some kind of coordination and analysis. The blue countries are the conservative welfare states. The reds are the social democrats. The orange are the Latin welfare states. And that's kind of related to the Mediterranean diet, orange. And finally, the grim picture of the liberal welfare states is illustrated by black. So the first thing is collective agreements. And all you have to do is ask a bunch of social workers or students, how many of you work under a collective agreement? And when they raise their hand, they say, what do you get from that? Well, I get vision, I get dental, I get guaranteed job increases. My manager can't turn to me and say, I don't like your face, get out of here, you're fired. Collective agreements are really good. And the evidence is that not only do collective agreements provide higher wages, but they provide a greater sense of security and more opportunities for training, advancement, and benefits. And Andrew Jackson's book on employment documents that. So here we are in Austria, Belgium, and France, and something like 95% of people have collective agreements, which is remarkable if you think about it. Now, it turns out, I'll show you a slide, that this isn't so much of a union power as much as it is a general sense that we're all in this together. And what you find is employee associations. So BMW talks to Volkswagen. They all talk to each other, and they bring in the unions, they bring in the workers. Many countries have commissions. And what basically they do is they come to the realization that if you want to have a productive, quality economy and decent quality of life, you have to provide your co-citizens with decent security. So what you see here in terms of collective agreements is you have the conservative countries and the social democratic countries with rather high. I mean, if you begin at 70, let's say 80%, 4 out of 5 workers. 4 out of 5 workers in Norway, Spain, Italy, so forth, have collective agreements. And it's the countries that are the liberal welfare states, such as Canada. Where's Canada? Canada, oh, Canada's right at the bottom. 32% of workers have collective agreements. And of course, many of them are public workers, and by the time Rob Ford gets through with them, so what happens is you guys don't have a collective agreement. Rather than say, why don't I have a collective agreement? You look at those guys with the collective agreement and you go after them. Right? You go after those teachers. You go after, that's what's happening in the United States. So collective agreements, I've never, ever run across a health promotion or population health document that came out of Canada, or for that matter, Australia and maybe the UK, that ever talked about a collective agreement in relation to health promotion. Unions. Well, Sweden, Denmark, Finland, and Norway. For most 3 out of 4 countries, 2 out of 3 belong to a union. And even when you don't belong to a union, once the union passes or comes to a collective agreement, that collective agreement is frequently applied to all of the other workers who may not be part of the union. And what you can see here is that Belgium, Luxembourg are relatively high, but Canada and all of the other liberal countries are rather low. Canada, 27%, United Kingdom, 27%, Australia. But the difference that's interesting is that even though there's small unionization rates in Germany, the Netherlands, and Switzerland, and France is really low. You get the sense the unions are really all-powerful. But they're not all-powerful, they're influential. And the worst of both worlds is to have weak unions and no collective agreements. And that's the situation we have in Canada. Now, as it turns out, even though people may not believe it, when governments spend money, it's usually good. Because usually when governments collect more revenue and they spend it, they tend to spend it on things like public transportation, housing, baby bonuses, education, health care. And it turns out that the social democratic and conservative countries are rather similar in their commitment to collecting revenue and publicly spending it. Now, of course, when you live in a society where everybody says governments are bad, the idea is to get governments out of the way, you end up with something like the USA, where basically only 16% of GDP. And what you can see is that Canada has been going on a downhill trend over the years. And this is something which, again, outlines some of the barriers we'll have in terms of improving things, because you're not going to get child care, you're not going to get good public transportation, you're not going to get an expanded train system in Canada unless governments spend money. And when governments don't spend money, you have issues. And again, this is the ideological inspiration of getting government out of stuff and leaving it to the private or corporate sector. Now, this is an indicator of quality of life, income inequality. And again, the interesting thing is that while Denmark and Sweden certainly lead the way, and for those who don't know what the Gini coefficient is, a Gini coefficient is deviation from equity. So if a society was perfectly equitable, that the bottom 10% got 10% of salary, the next 10% got similar amounts, the Gini coefficient would be 0.00. When Bill Gates earns everything in the United States, when one person gets all the income, then the Gini coefficient is 1.0. So for those who are economically oriented, it's called the Lorenz curve. And it's really quite neat if you look at it. But it basically says that if there's equity, the cumulative relationship between population and income is linear. 30% of the population gets 30% of the income, 50% of the population gets 50% of the income. When things are out of whack, the curve isn't like this, it's like this. The bottom 20% have very little of the income. The next 10% get a bit more, but it's when you hit the top 30% that the cumulative income really goes up. And the Gini coefficient is neat because you could apply it to wealth, you could apply it to housing. What percentage of the population has what percentage of the housing space? But the bottom line here is that I love data like this. This is pretty clear that the countries with the greatest inequality, which is a reflection of tax structure and so forth, are the liberal and the Latin welfare states. And again, we don't have to point to Denmark or Sweden anymore. We can point to Luxembourg and Austria and Belgium as countries that are taking significant efforts to limit inequality. And one thing the social democratic countries do really, really well is poverty. not only do they get their poverty rates down to 3 or 4%, but they hire people to go out and find those 3 or 4% so they can throw money at the problem, literally. When was the last time you heard about people trying to seek out poor people in Canada in order to give them more benefits and supports? And the United States, of course, is in a world of its own. And Canada, as you can see, is continuing. We've been pretty well at 15% for a while. But we certainly, in terms of where we're moving, are moving close to the United States. Active labor policy. This is what drives the Conference Board of Canada and enlightened business leaders crazy. I can't use the word crazy. Frustrates them immensely. And what this basically is government spending on apprenticeships, on job training, on support. So when people get laid off, you're not told to go home and rot. And what you can see is that the Scandinavian countries spend over 1% of GDP, at least Denmark and Sweden does, followed closely by some conservative countries. And you can see Canada basically brings up the rear. And in one of my classes one night, somebody said, has that changed? So we went to the OECD database, and we found that about 15 years ago, we used to spend 0.6, 0.7%. So again, it's governments getting out of stuff with consequences. If there's a changing post-industrial economy, what you want to do is make sure that workers are able to do this. But you know what, you heard the news today about the new immigration targets? That we're only going to take, it used to be we just took rich people in. Now we're going to take young, well-educated people in. And of course, we always bring in the skilled workers. We won't spend the money to train Canadians to do it, so we bring these people in. Well, you think that was bad. Childcare and early education services. And this is where Fraser Mustard, as you may recall, was a medical physician from McMaster University. He made his name in blood platelets. That was his thing, blood platelets, which is good. I mean, it's important stuff. Many of these people, as they retire, they suddenly discover that there's poverty, there's children, and they really work hard. They produce reports, they get the Order of Canada, and that's about it. That's about as far as it goes, because we don't take any of this stuff seriously. We don't do anything for children in this country. And what you can see here in terms of spending, at least Greece spends a lot of money on pensions, public pensions, which I don't have the slide for. Canada is right on the bottom on public pensions as well. So we don't take care of the kids and we don't take care of the adults. Today I got my Canada pension plan statement, which was a real blast from the past because it begins in 1973. And it said that if I retire at 65, which will be in 4 years, I get $1,200 a month. Now, luckily in York, we unionize. And so luckily I don't have to depend on Canada pension plan, but it's pretty bleak. So again here, again, the point is you don't have to compare yourself to Denmark or Sweden or Finland. We can just compare ourselves to countries like France or Belgium or even the Netherlands. Now what about how does this convert to health? Well, let me put it this way. I'm in health, so I got to put some health indicators in. But I would make the argument that there's a lot of really good indicators of quality of life. But as it turns out, in terms of life expectancy, there's no relationship. There's nothing. But I can tell you that over the last 20 years, Canada is gradually slipping lower and lower. We used to be third, and then we were fifth. And right now we're 1, 2, 3, 4, 5, 6, we're eighth. And in the OECD data, they show the average improvement over the last 20 years. Canada is below the average, well below the average. But a more sensitive indicator, now we're the health people. What's the most sensitive indicator of population health? Most people argue. Infant mortality. babies born alive, it's dead within the first year. Now, this data has been kicking out for 20 years. Occasionally, somebody will come out in the Globe and say, oh, well, the measures are not comparable. For example, Sweden and Canada have a measure that if the baby takes one breath and then dies, that's infant mortality. And I say, okay, Sweden's using that? Look where they are. Infant mortality is said to be a really sensitive indicator because the pregnant woman is embedded within the society and is very susceptible to issues of stress, nutrition, insecurity. So infant mortality, no one disagrees that it's a really good indicator of overall population health, and I would take it the next step and say public policy that influences population health. And what you can see here is actually we do better than 2 other OECD countries. Anybody know what those 2 other countries in OECD? We do better than Turkey and we do better than Mexico. But I don't have Turkey and Mexico because they're not identified as one form of the welfare state. But again, look at Canada, 5.0. That's the average. And it turns out that when you look at the wealthiest 20%, would be about 4.0. And 4.0, these are the wealthy women. And the wealthy women are doing worse than entire nations are doing on average. So this is one that is worth paying attention to. Get the media to cover it? It's just not being done. Now, suicide rates. Now, one of the things you hear all the time, and I've taken to, I'll be giving a talk somewhere, not about this, and someone will say, yeah, but the Swedes kill themselves a lot more than Canadians do. And I'll say, I can't let that go by. So if you look at the suicide rates, you'll see that Canada has 10.1 per 100,000, and Sweden has 11.3. So that's about 10% higher, right? Let me just check that again. Canada is 10.2, Sweden is 11.3, 10% higher. So here's the rejoinder. Next time somebody says, oh, but the Swedes are killing themselves at 10% higher, you say, yeah, but we kill each other 200% higher. And what you can see here is that the takeaway from this is that the liberal welfare states, with their inequality, with their poverty, with their lack of government support, generally as a group have higher homicide rates. And 2 criminologists, again, may have been from the U of T, pointed out that not only is homicide rate significantly related to the amount of inequality in each of the 50 states, but if you even take the 10 Canadian provinces, there's a perfect linear relationship between inequality and homicide rate, with Alberta leading the way. Now look at the US. Okay, so what I did was I took those 3 exemplar countries and I simply took the 21 countries and I said, are these countries in the best, the top 7 in performance, the middle 7, or the bottom 7? And if we look at the Scandinavian countries, you'll see I have public commitments through expenditures, that I have key social determinants, and then I have health and social outcomes. You'll see that the predominant word in the social democratic countries is top or middle. Finland kind of messes things up in terms of life expectancy and homicide rates and suicide rates. My Finnish friend says that in Finland, if it snows really late, the suicide rate is higher. Because once it snows, it's brighter and people feel better. I don't know. But the main point for us in Canada is look where we are. Bottom 3rd in public spending, bottom 3rd in labor policy, bottom 3rd in early childhood spending, bottom 3rd in inequality, bottom 3rd in family poverty. We're in the middle, but we're really low in union density, and we're bottom in collective agreements. And we're middling in terms of health and social outcomes. Middle for life expectancy, bottom for infant mortality, middle for suicide rates, bottom in homicide rates. And whenever I say to myself, well, you know, I'm still doing well, I open up the paper today and see 2 high school kids were shot. My kid's going to be in high school one day. I got to worry about him being shot. That's why it affects all of us. So one of the issues, and this is what political economists say are important, is the issue of decommodification. And it's really quite good. It's basically saying, what happens if you can't perform in the labor market? Either you are unemployed, or you're sick, or there's no jobs, or whatever. What's your life going to be like? And decommodification is the extent to which you're able to get stuff for free, as opposed to commodifying it. About the only things that are decommodified in Toronto are libraries, and they're trying to get rid of that, and elementary school, elementary and secondary school. That's about it. Everything else you have to pay for. You got to pay for childcare, you got to pay for university tuition, you got to pay for public transportation. You pretty well have to pay for everything. But you'll see. Now, in 1998, Claire Bambra came up with an index of decommodification. And she came up with 2 things. One is the extent to which a country provides cash benefits to people. And this would be, you have a baby, you get $1,000 extra a month. The other one is the extent to which healthcare services are decommodified. In Canada, Medicare only covers about 70% of healthcare costs. We're among the lowest in the world, in the developed world. And what you can see in 1998, we were just in the upper right-hand corner. And that is that our health services were relatively decommodified, more so than these countries, but certainly less than Finland, Sweden, and Norway. And in terms of cash benefits, we did better than New Zealand, UK, Japan, Australia, and the USA, but again, certainly not as well as these European countries. And then I came across a new report by a fellow in Paris at, it's not OECD, but it's something like that. And he came up with a decommodified security ratio. And he's also published a paper about the European systems. And he basically says that security, economic support is guaranteed in all the human rights covenants. So a little bit of background. The Universal Declaration of Human Rights, the Copenhagen Consensus on Social and Economic Development, all of these covenants that Canada signs. And he came up with a ratio that would look at the replacement income for the risk of old age. In other words, what kind of benefits do you get if you're unemployed, sick, or disabled? What kind of benefits do you get in terms of health care, family allowances, housing benefits? And what does the society generally do in terms of just giving money out in order to combat social exclusion? And it's primarily income support. And again, it's redistribution of income and wealth. And lo and behold, I find that my simplistic slides that I provided you come up with the same results as his very, very complicated formula. His formula not only has those 3 things, but he also takes into account the percentage of the population that's living below what he calls the poverty line, which is 60% of the average income. So it's kind of an economic security index combined with decommodification. And not surprisingly, Sweden, Finland, Denmark, Netherlands, and Norway. The Netherlands are kind of interesting because they're clearly a conservative welfare state in terms of the organization of society. But they come out, not surprisingly, as the most decommodified. And rather than say decommodified, I'll say they are the world leaders in providing citizens with economic and social security. And in the movie Unnatural Causes, Is Inequality Making Us Ill? There's a story about workers in Michigan that get laid off, and they just hung out to dry. And then they were laid off, as it turns out, by a Swedish firm, Electrolux, but it was in Michigan. And then they go outside Stockholm, and they look at a Swedish worker who was laid off by Electrolux. But this guy's doing fine. He's learning psychology, he's bicycling, he didn't have to give up his house, he's getting 80% benefits. And then they move inside a union hall, and they're talking to these Swedish union members. And one person says, a woman says, what are these people going to do? How are they going to survive? And then the head of the union says, I don't know how I can live on 50%. And he said, you know, when you look around, you realize how lucky you are to live in Sweden. And that's really true, and the Swedes know it. Unlike the Americans who don't know anything that Sweden even exists, people in Europe know a lot about the United States. So what's the next countries? Well, it turns out they're the conservative countries. France, Germany. I can't see the next one. Slovenia, okay. Austria, Luxembourg, Switzerland, and Belgium. I mean, it's really neat how they kind of cluster together. The three southern countries correspond to the Latin countries, Italy, Greece, and Spain. And then he identifies the liberal countries, and the good news is we're marginally above Spain and Greece, which according to the situation in Greece is nothing to be proud of. And interestingly, Australia, Ireland, Russia, and the United States has like negative. I'll have to read the article over to figure out what a negative index is. But it's basically that there's so many poor people and they get so many minimal benefits, somehow they end up with a negative score. And again, Mexico and Taiwan. Now here again, I just wanted to lay this out for you because I really think this is a really good report to look at. And once you type George Menahem in, you'll come across his article in the, I think it's called Social Security, it's a European journal. And what he does here, the blue corresponds to the percentage of the population that's in poverty. And not surprisingly, you see that the Canadian, minus 11.3 or so over there, indicates that we do worse than certainly the countries to the left. The yellow is the benefits that are provided in terms of unemployment, retirement, and widows. And you can see that Canada, again, certainly does better than the countries to the right. The red is medical reimbursement and disability. Canada is a scandal when it comes to disability benefits. And this is the OECD saying this. Over 50% of people who apply for disability benefits are turned down the first time. I mean, by the time you're filling out the forms and applying for disability, I mean, people aren't just doing it on a lark. But it's been suggested, I teach in the critical disabilities program, that if you ever want to apply for you got two takeaway messages. If you ever go for social assistance, don't wear jewelry. And if you ever apply for disability benefits, have a lawyer over your shoulder watching you fill it out. It's that bad. And then finally, family accommodation and social exclusion. Again, you can see that our contribution in terms of this index is rather low. About the only thing that makes us really good is that we tend to compare ourselves to the United States. And if that doesn't work anymore, we can start comparing ourselves to Mexico. So it's really, it's very disturbing. And all I can say is that it disturbs me every day that this is what's happening. So what are the implications? And I'll finish up in about 4 minutes. The implications are, at least in terms of health promotion and health studies, that we have to pay attention to both the rhetoric and what governments actually do. We have to take into account public policy. And health promotion is going to go nowhere if we don't concern ourselves with public policy. In terms of the outcomes, I would argue that health outcomes frequently take a long time to manifest. So I think it's really a good idea to also take into account quality of life considerations. And perhaps that's where the Romano Canadian Index of Wellness comes in. The link between health indicators and form of the welfare state are not always obvious, such as the case of life expectancy. But overall, when you look at a range of indicators, we arguably show the worst indicators of health and quality of life. And that ultimately it comes down to politics. And when I gave this presentation in Switzerland, and again, it was so typical, there were about 60 people in Geneva at this international conference, and about 40 of them were Canadian. And the Europeans couldn't be bothered. There were some Europeans there. And, but how do you get an EU passport? So what are the implications? How do we make sense out of this? Well, luckily my wife was born and bred in Canada, and I was able to say to her, you know, when did public pensions come in? When did the original Canada Health Act? She said it was a Pearson Liberal government, but it was a minority government. Tommy Douglas held the balance of power. Childcare, well, the Liberals promised it in 1992, but they never got around to it until Jack pressured them to do it. And of course, the Conservatives got rid of it. And of course, we hear about the anti-poverty program in Ontario, and this is my all-time favorite slide ever. On February 9th, 2007, there were 3 by-elections in Ontario. And at York South and in Hamilton, the election was around minimum wages and poverty. And the Liberals lost both of them. And that's where Andrea Horwath got elected. And the next day, the Minister of Finance suddenly announced that there was going to be a poverty agenda. The moral being that if you think you're going to start losing elections, you better start paying attention to something. Again, a little bit of theory, because this is University of Toronto Health Studies, among others. A really good book by David Brady, who's American. And he makes the argument in terms of poverty, but it could also be in terms of general public policy, that to understand the differences, you have to understand the ideologies and interests of various sectors in society, the amount of coalitions, the strength of the labor movement, anti-poverty groups. These are coalitions that are able to organize people. He also makes the argument that what's absolutely essential is not only leftist politics, and he uses that phrase, leftist politics, but these politics having power through elections. So he makes the point that the little environmental movement here, the environmental movement there, really is not going to cut it. These parties have to win power. They have to get elected. And these latent coalitions and leftist politics lead to greater welfare state generosity, which are related to lower poverty, which then goes to influence the ideologies and interests. My suggestions are, in terms of his directions, in terms of increasing welfare generosity, we need to advocate for more generous supports and benefits. In terms of strengthening left political actors, you have to support the New Democrats. I used to say, well, let's support progressive liberals. No, doesn't do it. Build latent coalitions for egalitarianism, establish active networks of progressive citizens. And in terms of ideologies and interests, recognize the important barriers and build supports for anti-poverty, or I would say welfare state action. Finally, what is to be done? Espin Anderson argues that the social democratic countries are marked by their history of coalition building between labor and other sectors that has led to the development of universal public policies that have secured the loyalties of the middle class. Everybody buys into baby bonuses. Everybody buys into child care because it's made available for everybody. The conservative welfare state garnered the loyalties of the middle class by establishing hierarchical social insurance schemes, and this is usually through employment, that provide a variety of protections against risks through work-based contributions directed towards the primary, usually male, wage earner. The liberal nations, with their modest benefits targeted to the least well-off, which represents the weakness of labor movements and the dominance of business interests, have been less able to secure the loyalties of the middle class to the welfare state. Instead, the middle classes have given their loyalties to the economic marketplace. You're going to listen to me, or you're going to listen to Ted Rogers if he was still alive? You're going to listen to Ted Rogers. Because he's the guy who's going to improve your life, not some guy in Parliament. So I argue in that paper, and I also argue when I talk to groups in general, that this is the way you would really improve people's quality of life and health. You would help achieve collective employment bargaining through the strengthening of trade unions or the introduction of cross-sectoral bargaining. The second policy direction would be to distribute risk across the population through introduction of universal health and social assistance schemes that minimize individual susceptibility. But we're in a different era. In the movie Prairie Giant, John Diefenbaker talks to Tommy Douglas. And John Diefenbaker says, I'm getting complaints from people all across the country about why they have to pay for hospital care when people don't have to pay for it in Saskatchewan. And the Tommy Douglas character said, that's a good question, Mr. Prime Minister. Well, back then, Canadians knew about stuff. They read the newspapers. They knew there was something going on in Saskatchewan. When was the last time you heard women in Ontario, for example, saying, why do we have to pay for childcare in Ontario when they can get it in Quebec for only $7 a day? Now, if my students are typical, they don't even know Quebec exists, much less that there's a government there that provides childcare for $7 a day. Almost done.
But they all know about the Kardashian wedding thing.
You know, sometimes I don't know what they know. They know valences. Remember valences from chemistry? Valence, V-A-L-E-N-C-E, aluminum's plus, I still remember it. Aluminum's plus 2. They know that stuff. Well, we'll talk about that later. Let me just point out, for the benefit of the camera, my wife teaches at UT Scarborough. And it's not a lot better there either. So it's not just my university. So, learn more. Well, these articles I've been passing around, they just came out today. Irv Rootman says they're a tour de force. Tour de force? Not tour de force. But he says they're really good, and I work really hard on them. And if you can't get it through your university library, email me and I'll send them on. The Canadian Facts. Juha Mikkonen, who's a Finnish national, and I went out and did this on our own. You can get it for free at canadianfacts.org, or you can help reimburse me for all the money we spent in printing these. It's been downloaded 44,000 times. It's really something. No media coverage, nothing. We did this. Here's my advertisement. If you're teaching a course and you want to spend about 3 weeks on the determinants of health, I suggest this Fernwood book about Canada health and illness. If you're spending like 1 week, you want to use this. And if you're teaching the entire course of 12 weeks, you want to say, as Saddam Hussein would say, the mother of all social determinants of health books. And this is with chapters by anybody who's everybody. And this presentation and others are sitting at my website. I have a number of websites, but this is the one that doesn't have much of anything on it. But it does say that, welcome to Dennis Rayfield's website. And if you go into the library, you can access all of these slides. The overwhelming majority of them are in PowerPoint, so you can go out and use them, which really helps if you find yourself being a sessional instructor hired very quickly. So thank you, and I hope that it's been useful. But again, it's bleak. It's bleak. However, I think that when people have a better understanding of what we're really dealing with here, it provides means of knowing where the pressure point should be. And for the first time, we do have a New Democrat Party opposition in Ottawa, which seems to be maintaining its popularity. So thank you, and questions?